All right. So, are we good to start? Can we begin? I think the others will be able to flow with us as they come in. So, good morning, good afternoon, distinguished guests, colleagues, and friends. Welcome to November edition of Cheap Talk Africa, a platform where we drive conversations that matter for Africa's health security. Our theme today, from rabies to resilience, from rabies to resilience, strengthening One Health against zoonosis. It reflects a critical shift we must make from reactive disease campaigns to proactive, integrated health strategies. We know that rabies remains one of the deadliest yet most preventable zoonoses in Africa, especially Africa, Asia. Its control offers us a powerful blueprint for building resilient health systems capable of tackling other zoonoses like avian influenza, brucellosis, Lassa fever, name them, to mention just a few. Our objectives today are clear. We want to highlight rabies control as a model for integrated One Health action. And secondly, we want to share practical lessons from Namibia, Nigeria, and grassroots veterinary practice. And we want to finally identify actionable steps for strengthening zoonotic disease resilience across Africa. So this conversation is timely and is also urgent, since human, animal, environmental health are interconnected. Without integrated systems, outbreaks escalate into epidemics. So together we can change that narrative. At this point, I am actually delighted to hand over this steering of today's dialogue to our capable moderators, Dr. Nuhu Suleiman and our student doctor, Asiya Salawuddin, who will guide us through this engaging and insightful session. Thank you so much for being here. Now, please let's make this dialogue count. As I hand over to our moderators, Dr. Nuhu Suleiman and our student doctor, Asiya Salawuddin. Thank you very much.
Thank you very much, Dr. Grace. Before I start, I've been trying to on my video, but it's showing that it has been disabled by the host. So I don't know if I should continue while you check it.
Let me quickly check and see how that happened. Asiya,
Yes, ma'am.
try starting your video.
Yes, I just clicked on it, so it's loading.
Great. All I just did was to click on ask to
It
start
has
video.
worked now.
Oh,
It has
great,
worked.
great. Okay, so go ahead.
Good morning, everyone.
Good
Thank
morning.
you very much, Dr. Grace, for the warm introduction and for convening this message and this meaningful conversation. Good morning and welcome once again to the November edition of the Chip Talk Africa. So before we begin, I would like to share brief. This conversation is designed to show how rabies is more than a single disease challenge. It is one of the strongest and entry points for building the true One Health resilience. It teaches us the importance of integration, community trust, and collaboration, and a shift from reactive response to proactive prevention. We're joined today by three incredible discussants who bring national, regional, and grassroots perspective to this conversation. Let me introduce them. Dr. Idris Ibrahim Kelta, Dr. Rauna Atingo, and Dr. Mary Obi. I would briefly read a bio and citation of all three discussants. Dr. Idris Ibrahim Kilta is a veterinarian and public health professional with extensive experience in animal health system, One Health coordination, and zoonotic disease prevention. He currently serves as the director, One Health Coordination, Kaduna State Center for Disease Control and Prevention, where he leads multi-sectoral collaboration and contributes to strengthening the state health security architecture. He played a key role in developing Kano State Action Plan for Health Security. Dr. Kelta is also an animal health officer with the Kano Livestock Productivity and Resilience Support Project, Kano LPRES, a world-wide initiative that aims to improve livestock health, productivity, and resilience across the states. Before these roles, he served in Kano State Ministry of Agriculture and Natural Resources, where he worked as a veterinary clinician at Gwale Veterinary Hospital for 15 years and as the Rano Zonal Veterinary Officer for 5 years, providing clinical services, surveillance, oversight, and zonal coordination for animal health program. Please help me welcome Dr. Idris. Now on to Dr. Rauna, who is our next discussant. Dr. Rauna is a veterinarian with academic qualification in agriculture, veterinary medicine, management, and One Health. She completed a national diploma in agriculture at the University of Namibia in 1998 and earned her Doctor of Veterinary Medicine degree from Kazan State Academy of Veterinary Medicine in Russia Federation in June 2005. She later undertook in-service training at the University of Stellenbosch Business School. Business School in South Africa, obtaining a certificate in management in 2012. In 2018, she completed her master's in animal/health/ecosystem health, in brackets, One Health, majoring in policy and legislation at the University of Pretoria. Her professional career began in March 1st, 2006 at the Directorate of Veterinary Service, Central Veterinary Laboratory in Windhoek, where she worked in the virology section with emphasis on rabies diagnosis, as well as the pathology of parasitology section. In November 2006, she was appointed head of regional laboratory, overseeing activities in virology with focus on rabies diagnosis, pathology, and parasitology. She advanced to the position of regional head of the Division of Animal Disease Control in November 2010. From February 2015 to February 2021, she served as the national coordinator for Namibia Rabies Elimination Project, leading national efforts aimed at eliminating rabies in the country. Welcome, Dr. Rauna. And lastly, our last discussant is Dr. Mary Obi, who is an energetic, passionate, and forward-thinking veterinarian. She blends her love for animals with a strong embrace of technology and innovation, known for her resilience, her strength, and unwavering dedication to her profession. She has become a respected voice in animal health, public health, and community advocacy. She earned her HND in animal health and husbandry in 2005 and later obtained her Doctor of Veterinary Medicine in 2011, both from the prestigious University of Nigeria, Nsukka. Dr. Obi completed her internship at the National Veterinary Research Institute, NVRI, in 2004, Equa Veterinary Clinic, JOS, in 2008, and in 2014 experiences that broadened her clinical exposure and shaped her as a practical hands-on professional. With over 20 years of experience in livestock management, she has developed a strong mastery of animal husbandry animal health, and welfare practices, delivering solutions that support farmers, pet owners, and communities. She is also the CEO of Regnum Animalia Veterinary Service Enugu, where she provides high-quality clinical and advisory services. Her passion for rabies awareness was born from first-hand encounter with severe rabies cases during her time in Jos. These experiences ignited a lifelong commitment to educating communities about the dangers of rabies and life-saving power of vaccination. Today, as a proud WAF advocate, Dr. Mary Obi has led impactful anti-rabies campaigns across schools and communities, championing responsible pet ownership, public health awareness, and proactive animal care. Through her outreach, she continues to bridge the gap between animal health and human safety, saving lives, empowering community, and inspiring the next generation of veterinarians. Welcome, Ms. Obi. We are honored to have you all with us today. On the next segment, I would call on Dr. Nuhu to continue. Thank you all.
Thank you.
Thank you very much, everyone. Good morning, all.
Good morning.
We are all welcome once more to our November episode of the Chip Talk Africa. And I'll go straight to the warm-up questions to avoid wasting much of our time. When it comes to the talks of zoonosis and One Health issues, we have been hearing of avian influenza, we have heard of coronaviruses, we have heard of brucellosis, but there is one question that keeps ringing in my mind or in almost all of our hearts, and the question is, why does rabies remain one of the strongest entry points for strengthening One Health resilience in Africa? And I want the participant, the discussant, to pick up the questions and address it so that we can start from there. Thank you. Hello, good morning.
Good morning.
Good morning.
Can I perhaps take the center stage? Can you hear me very well?
Yes, we can hear you, ma.
Okay. First of all, I would like to thank Prof. Grace with her team for the invitations. As a country, as Namibia, as a Directorate of Veterinary Services in Namibia, we appreciate the initiative as well as the invitation to attend this very important discussion. To answer to the question
let me repeat the question again. Why does rabies remain one of the strongest resilience in Africa?
Yes. Rabies continue to remind us of a very simple truth, yet it's a very painful one. When animal health systems are weak, communities suffer, especially the most vulnerable one. Yet, rabies is entirely preventable, and we normally say it's 100% preventable. By choosing rabies as an entry point for One Health resilience, we are not only just fighting rabies as a disease, but we are building the systems, we are building the partnerships, we are building the public trust that are needed for us to confront all zoonotic threats. And rabies, it teaches us that no sector can succeed alone. You cannot operate in a silo. It demands collaborations, it demands community engagement and sustained political will, because we need funding from the people who have got the money, and it has to be driven by policies as well as articulated legislations. And when we get rabies right, we strengthen our surveillance, we strengthen our vaccination capacity, the animal movement control, as well as our data systems and the cross-border collaboration. And in this way, rabies becomes more than a disease, meaning that we are going beyond simply controlling rabies to building strong, sustainable systems that can prevent, that can detect, that can respond to other future diseases or other future zoonotic or any other existing zoonotic diseases. And it becomes now a getaway to resilience, One Health systems that now protect the lives, that protect their livelihood, because rabies alone, it doesn't only affect humans and dogs, it also affects the livestock, which are the main source of income as well as sustenance for our community, as well as the future of animals and animal health in our country as well as in Africa at large. I think that is what I can contribute to the question as why rabies remain a critical entry point for One Health. Thank you.
Thank you very much, Ma, for your amazing response. I think we should hear from our mommy. I don't know if yes, Ma. So I don't know if our father, our senior comrade in the fight against rabies, Dr. Idris Kelta, would have something to say to add to what Dr. Mrs. Rona said. Why does rabies remain one of the strongest entry points when it comes to One Health resilience in Africa? Thank you very much, sir.
Yes, thank you so much. You have to bear with me because of the right now I'm on transit and there's a lot of network interruption. Yes, yes. Rabies has still many critical entry to One Health resilience in Africa. Why? Because it is 100% fatal when when people get infected with animals, and again it's also 100% vaccine prevention. You see, in Africa, annually about 21,000 to about 24,000 people die as a result of rabies in Africa. And this exposes our weakness in multi-sectoral weaknesses in human, animal, and environmental systems. And mass animal vaccination, particularly dogs and cats, collaboration, and it's really working. You know, we need collaboration of veterinarians, physicians, and environmental health officers, and that can lead to, you know, strong resilience, supply chain across the sectors. and coordination. And this pathway, when adapted to other zoonotic diseases, it can really help us in controlling and eliminating most of these zoonotic diseases. Thank you.
Thank you very much, sir. Thank you very much, sir. You mentioned something very critical to rabies, which is the case fatality rate. You mentioned the 100% case fatality rate for rabies, so also the number of deaths we have annually. So that is a very important point to note. I don't know if Dr. Mary Obi has something to add to the question. Why does rabies remain one of the strongest entry points for strengthening One Health resilience in Africa?
Okay, thank you very much, Doc. From what my colleagues have said, I think I'll just add that it's very, very important because rabies is still fatal, but we can still prevent it by vaccination of our dogs. And from the grassroots here, the communities here, most of them are aware, some are not aware, and some they are nonchalant about the whole thing. So if we engage them and they are aware.
Good morning, ladies and gentlemen. Thank you very much for joining.
If we engage them and we are aware, and they are aware of these deadly diseases, and they know that they can vaccinate their pets, I think it will go a long way in reducing the incidence of rabies in our communities. Thank you.
Thank you very much, Ma, for your contribution. Dr. Mary Obi mentioned the issue of awareness. With the more we increase awareness about rabies, so also we could extend the level of awareness to other zoonotic disease, and so that way we could strengthen the One Health framework in Africa. I think I will, my co-moderator will take it up from there. Asiama, thank you.
Thank you very much for those insights, and thank you very much, Dr. Nuhu. We'll now move into our first thematic segment, which highlights policy and regional leadership from Namibia. And Dr. Nora, I will begin with you. My first question is, Namibia already has a national rabies control strategy. What key transferable lessons can the rest of Africa learn from your model? Dr. Rauna?
Yes, can you hear me?
Yes, ma. Should I take my question again?
I got your question.
All right, ma. Okay.
Yeah. Thank you very much for this very good question. But I should say, as a country, we are not yet there. We are not yet perfect. We are still learning. And maybe to build to my response, I should start off with at a global level, the global strategy for global strategic plan.
Sorry, I'm so sorry, Dr. Rona.
Yes.
I was just informed that since Dr. Idris is in transit, so as to enable the network not to crash on transit, we would start with him, please. I sincerely apologize with you.
Okay.
Because the network might be unstable.
Okay, thank you.
Yes, ma'am. Dr. Nuhu, I think since your question is for Dr. Idris, please can you start? Thank you very much.
Thank you very much, Asia, for your listening. Dr. Idris, who happens to be the current director of One Health Coordination with the Kano State Center for Disease Control, has been at the forefront in the fight against rabies and other zoonotic disease. So, sir, my question to you, sir, is So how is Nigeria's One Health framework being implemented at the state level, particularly in Kano, sir?
Yes, thank you so much for this question. Nigeria's One Health framework is gradually transiting from federal concept to practical state level structure. And in this course, Kano State is on the lead. Kano is leading on this evolution from concept to real practical One Health structure. Kano State is the first state in Nigeria that has established subnational Center for Disease Control and Prevention. And again, in this center, we have dedicated departments, One Health Coordination Department. And our implementation strategies focuses on the institutionalization. We are able to institutionalize Kano State One Health platform. This platform comprises of One Health Technical Committee, which is high level decision making committee. The composition of this committee, the steering committee, comprises of the Honorable Commissioner for Health, who is the chair of this committee, and then Honorable Commissioner for Livestock Development, co-chair. We have the Commissioner, State Commissioner for Finance, State Commissioner for Information, State Commissioner for Budget and Planning, State Commissioner for Local Government, and also the DG, Kano State Center for Disease Control, serves as the secretary to that committee. We also in that committee we have director, public health and veterinary public health and epidemiology, Ministry for Livestock Development. Also have director, One Health Coordination at KCDC. And the other committee is technical committee, which is the implementing committee, comprises of technical directors for implementation of One Health strategies and agendas. And this committee comprises of directors from State Ministry of Health, State Ministry of Livestock Development, State Ministry for Environment and Climate Change, and other technical members from relevant FFPs. And also, the strategy we focus on implementing this One Health framework is also operationalization of this strategy. We do have joint field investigation, risk communication, approach plan, state action plan on health security. And this is a multi-sectoral integrated strategy, One Health strategy that outlines how Kano will respond, how Kano will prevent, detect, and respond to public health threats. This strategy focuses on strengthening One Health surveillance, laboratory capacities, risk communication, multi-sectoral coordination to build resilience, health security in Kano. Thank you.
Thank you very much, sir, for your for your answers to our questions. And from what you have said, we can clearly see that Kano is not only setting the phase or leading in Nigeria, but also Kano is setting the standards for the strengthening One Health resilience in Africa as a whole, from the number of caliber of parastatals and stakeholders involved. Kano is really doing an amazing job in the fight against zoonotic disease and also building the One Health framework. Thank you very much, sir, for your contribution. I think I will go to the next question, sir, which is what role does data-driven surveillance and reporting play in preventing zoonotic outbreaks, especially in Kano, sir? The role of data-driven surveillance, sir.
Thank you so much, Dr. Lu. Data-driven surveillance is the backbone of early detection and rapid response. In Kano, it's the use of data helps us in a number of ways. It gives us opportunity for early detection of threats, and before it escalates to outbreak. It also helps us in planning strategic intervention, vaccination, community engagements on hotspots of outbreak, and things like that. Thank you.
Thank you very much. So the next question, sir, is that you have partnered with War Against Rabies Foundation during the World Rabies Day for information, communication, education and communication materials, and even rapid diagnostic testing, etc., sir. So how does such collaboration strengthen resilience, especially in Kano, sir?
You see, with regard to the support we are enjoying from the WAF, particularly during the World Rabies Day, last World Rabies Day commemoration, we have gotten a lot of IEC materials, and some are in English and others are in our native language, the Hausa language. And that has really helped us. That has really helped us in our sensitization and community engagement. And again, the work also has assisted Kano State in donating some quantity of MVT, rapid response diagnostic kits, which has really helped us in the turnaround time for lab confirmation, tentative diagnosis. That gives us an opportunity to start responding immediately, particularly for exposure to human. When we have tentatively confirmed that it's a rabies positive, using the rapid test kit before we sample is out, from our regional referral lab, NVRI involved for confirmation. We're really happy with this partnership. It has really impacting our One Health collaboration in Kano State. Thank you.
Thank you very much, sir. From the information you have shared, sir, it's very obvious that strategic collaborations like the one with War Against Rabies Foundation and also with other stakeholders is critical in building One Health resilience against rabies and also zoonotic disease in Nigeria. Thank you very much, sir. And I think to sum up everything you said, you mentioned the issue of surveillance, building of diagnostic capacity, as well as risk communication, which are critical areas in the war against rabies, as well as other zoonotic diseases. And we can see that Kano State is really doing well in that and is setting the pace. We are wishing you well in the endeavor, sir. Thank you very much. My co-moderator will pick up from here.
Thank you very much, Dr. Nuhu. Dr. Idris, that was very, very insightful. Thank you so much for your contribution. Like I said earlier, we would move on to our first thematic segments. And this segment highlights policy and regional leadership from Namibia. Dr. Rauna, I would continue with you and I would repeat my first question again, which is Namibia already has a national rabies control strategy. What key transferable lesson can the rest of Africa learn from your model?
Thank you very much for the question. As I alluded to earlier, where I wanted to start off, is that the global strategic plan to end the human death from dog-mediated rabies by 2030, it underscored or recognized that there was the global response has been fragmented and uncoordinated. And there was a need to break the status quo and come together with a combined will and achievable goal and also a common plan. This was recognized in 2015 when the world called an action by setting a global goal of zero human dog-mediated rabies death by 2030. And this was being led by the global organizations, which is the WHO, the WOHA, FAO, as well as GALC. I have to highlight this because this is where countries are building on their national strategies. But I should state here that as a country as Namibia, I think we were already a step ahead because by 2015, before this global meeting, our national rabies strategy was already launched. As a country, we were already a step ahead. And to answer now to the question is that there is a number of lessons that other countries can learn from Namibia. We are not perfect. We are trying. We are also learning from others. But through the implementation of our strategy, we have actually learned that the following can be good lessons where countries can actually build. Number one is that you should have a clear, unified policy framework that has to drive your actions. What does it mean? It means that as a country, rabies is one of the diseases that are recognized by the state as a notifiable disease in Namibia, as per our Animal Health Act, the Act 1 of 2011. However, rabies vaccinations has been a national program for so many years, but by then we lacked a strategy. Hence, there was a need for us to re-strategize because there was no progress. Animals have been dying of rabies. Human beings have been dying of rabies. Hence, now the National Rabies Control Strategy was launched in 2015, and we piloted it in 2016, and it provides a single and coordinated roadmap for all sectors, meaning that all sectors who are the stakeholder to these strategies, they have a clear and defined activities that they need to carry out for us to achieve our common goals. And it aligns now veterinary, public health, local authorities, and communities structures behind one shared objectives. And that is actually reducing the fragmentation as well as the duplication, meaning the limited resources each of these sectors is having, it has to be shared. And the whole idea is for us to achieve the elimination of dog-mediated human rabies. I would like to highlight that we also have a problem of a wildlife rabies issue, the sylvatic form. But under this strategy, our focus is more on dog-mediated human rabies. Another lesson under our policy framework that countries can learn is that in 2019, Namibia signed a commitment letter to OHA towards target 2030 to achieve dog mediated human rabies by 2030. And moving forward, by 2021, Namibia acquired the WOHA recognized rabies national control program. It was the first country in Africa. And I think for now we are a few, maybe about 3. I think Zambia and Tanzania is one of them. I'm speaking under correction. And this is a voluntary commitment. However, it's also subjected to annual reconfirmations, and it's a 5 years program. So that is one lesson that countries can learn under a unified policy framework. Another clear lesson that they can learn is that dog vaccination and rabies surveillance are at the center pillar of our work, meaning that Namibia, we have placed mass dog vaccination at the heart of this strategy. We carry out what we call targeted mass dog vaccination campaign, which are supported by our surveillance data. We focus on our hotspot area where we have got quite a number of, or any case of rabies being reported, or whether it's in humans or in dogs or in livestock. And our campaigns, mass dog vaccinated campaign, they are very short and very targeted. And we use the limited resources strategically. And this simple evidence-based approach has delivered measurable reduction in dog-mediated rabies, and also demonstrated it is cost-effective to policymakers. So another lesson on top of the 2 that I have mentioned is that we have seen in some other countries that the rabies control is being spearheaded by organizations. Sorry, can someone help to mute people because it's irritating on my ears? Can the co-host and host mute the people, please?
Centrifugation.
Thank you very much. I was saying that in other countries, what we have observed that the activities of rabies, they are being implemented by organizations, which comes in, they implement, the implementation comes to the end, and then the sustainability becomes a nightmare. However, in Namibia, we have got a strong government ownership in order to ensure that beyond the funding that we are getting from our partners, we will be able to sustain this project or these programs moving forward. So rabies control is a government-led with technical support. We have to acknowledge highly from our partners through OHA, and then other organizations such as the FLI from Germany, as well as other partners like GALC, and the financial support that we got from the federal government of Germany that are supplementing to our government funding. And I would say that from the yearly activities that we carry out, 80% of the funding comes from government. Another lesson that they can also learn is that the integration with One Health, it also strengthens our regional capacity. So we use the rabies and entry point, if I have alluded to earlier, in order to build a broader One Health systems by improving our surveillance, by improving our diagnostic, the movement control, the data capturing, and also the community engagement that also support control of zoonotic diseases. And by doing that, we have to collaborate with other partners. Like now in the country, we are collaborating with the Veterinary Association of Namibia. under the association, that's where they organize campaign through private veterinarians. And we are also collaborating with the NGOs. We have got organizations like the Cheetah Conservations, the Heavy Heart, which normally runs the dog population management activities through spending neuter in such a way every dog that is presented for spending neuter or a cat, it has to be vaccinated, and we share the data. And they also provide the basic veterinary services, especially to the most vulnerable people who cannot afford private services, or they are not able to reach where government facility are. And another thing is that by doing so, we are actually leading to our common goal of eliminating dog-mediated rabies in Namibia, and also making sure that the most vulnerable citizens in this country, who are the children, are actually safe around their dogs. When the dogs are vaccinated and they are protected, and that's why we are also protecting the human populations. Another engagement that we, or collaboration, is with the community leaders. Rabies control, it has to be owned by the community. And this can only be happen in an effective way when you capacitate the community leaders in such a way they are able to educate as well convince their community. And another most crucial thing is that there are so many myths around rabies as a disease, and we can only debunk that through interaction or through engagement with our community leader, because many people in the villages, they have got a different understanding when it comes to rabies. And another lesson is about the community engagement. Is more or less linked to what I have alluded to, but I would like to just highlight that we invest a lot when it comes to awareness, and we do a lot of outreach to schools and to the local leaders, as I have said it earlier, as well as to community mobilization. By doing so, we are recognizing that rabies is controlled in villages and not in the boardroom. You cannot implement this task while you are sitting in your comfort zone. You have to go out. You have to educate the people first before you start implementing. And later come now the enforcement of the law that you are having, because you cannot start enforcing something while you are not telling the people why you are doing what you are doing. The most crucial one is the digitalizations of our data. When we started, we were using paperwork, which is very cumbersome, and sometimes you can lose your data. And we have actually now shifted to use tools from GALC, mobile app, whereby we use the rabies vaccination tracker. We are also using the rabies surveillance tracker, the rabies education initiative tracker. The rabies initiative education initiative tracks, it is more linked to our awareness, because we normally put a target for each community to say, if you have got a total of so much schools, how many are we going to target? And we have to plot it in our map to say, so far we have achieved so much target. And if we didn't reach the target that we have planned for that particular year, then we can now review our activities and see how can we improve. And also by using that app, we are also able to visualize our data through that platform. In case of rabies now in livestock, we are using the NAMLITS. This is a government database whereby we can use digital movement permits. We are able to record vaccination. We are able to record also the health status of the animal. In case in a community rabies outbreak has happened, we are able to record over how many response vaccination was done and which animals was actually vaccinated. And in terms of also a disease outbreak, we are able to trace back and trace forward of how many animals were moved from that crawl to any other destination, and then we can now do a follow-up. The most crucial one, rabies has got, or any other disease has got, they don't know any border. And the cross-border collaboration is treated as a priority, not as a afterthought in terms of our implementation. We make sure that through our implementations, we reach out to our neighbors, we collaborate with them. We are engaging with our neighbors through the regional bodies like SADC, as well as the WOHA networks, by demonstrate how regional coordination can break transmission cycle and harmonize our standards across the border. We, as a country, we are also providing capacity to our neighbors, which they have identified themselves. Specifically, we collaborated with Angola, where we capacitated them on mass dog vaccination planning and implementation, disease surveillance, and laboratory diagnostic. And also the most crucial one, when we are vaccinating, as we all know that our borders in Africa, they are measured by the line. We don't have a close border.
Sorry, please, can you mute your call? Ishaku, can you please mute? Thank you.
Thank
Sorry
you.
for that, Dr. Rona.
Thank you. The cross-border vaccination, we don't limit to vaccinate only our own animals. Any animal that is presented along the border, whether it's a Namibian, an Angolan, a Zambian, we vaccinate. But of course, there is also a gap on that we need to address in terms of separating the data to say this animal came from the other side of the border and so on. The last one, and is what normally measure our success or no success and the gap, is our yearly planning and the review meeting where all stakeholders, they participate. We have to review what we have planned, what have we implemented, where are we running short, and what are supposed to be done. And this meeting is being attended by all stakeholders. I think that's what I can contribute to the question, what other countries can actually learn from Namibia. And through those main activities that I have highlighted, we have actually seen that it really improved our vaccination data because we have been moving from strength to strength compared to where we were before the implementation of the strategy. I thank you. Over to you.
Thank you very much, Dr. Rona. I got a really, really insightful policy from you. And the first I really love is that of breaking the status quo. That is like the first thing people really need to take note of. And planning and setting a goal. Then talking about the mobile app, that is also a very, very good strategy in trying to eliminate rabies. Until the next question I have for you, the next question is, in what practical ways has One Health integration helped Namibia prepare for other zoonosis beyond rabies? If you could also touch briefly on any innovation or any approaches that has surprised even your team, that would be insightful. Thank you.
Thank you very much for that. Another good question. I don't really want to praise my country, but I should say I'm proud of what we have achieved so far. There is a growth evidence that Namibia or the Directorate of Veterinary Services use of a Namibia tripartite One Health national strategy. And it integrates actually a multi-sectoral approach that has significantly improved rabies control, and also it is strengthening the readiness for other zoonoses. And by doing so, through One Health integration, it also making a difference in our policy and also on the national leader or regional leadership. And what really comes out through the One Health integration is that the adopted national rabies control strategy explicitly use a One Health model whereby we have integrated animal health, human health, as well as environment and the community. We did not leave the community behind, because they're the one who are owning these animals that we are interested in. And apart from that, apart from the strategy of recently, that was now last year, the tripartite One Health national strategy was launched, which is a 5 years program, sitting. And it was launched to institutionalize the long-term cross-sector collaboration by ensuring that there is a sustained leadership across ministries, or like Ministry of Health, Ministry of Agriculture, as well as Ministry of Environment, and other sectors that are implementing same activities towards that common goal. And there is a national task force that was also established under this tripartite One Health national strategy. And it also unified the framework that enabled the aligned planning, as well as the resource allocation, as well as also accountability, because they are trying to reduce the duplications and also ensuring that there is a cohesive response to zoonosis, not only towards rabies, because there is quite a number of diseases that are listed under this tripartite One Health national strategy. And the other One Health integration approach for other zoonoses that we can highlight is that the effectiveness of rabies elimination efforts through mass dog vaccination, as well as surveillance. I have alluded to that, but I would like to go deeper to that by saying that since the implementation of One Health, which is led through mass dog vaccination campaign from the beginning of 2016, there is Namibia have extended actually this campaign across the northern communal areas, which is a hotspot area, and now we are doing it at a national level, meaning that the whole country. And this campaign, often we don't only focus on mass dog vaccination campaign, we also integrate our vaccination of dogs during annual vaccination campaign for livestock. And by doing so, we are able to reach the remote and the rural community more efficiently, and also improve our access, as well as the uptake in terms of the number of dogs that are vaccinated. And as a result of these efforts, the number of human rabies deaths have actually dropped significantly. We have seen a significant drop from 23 cases that were recorded before the implementation of the project, that is beyond 2015. And at one point we came to a 0 case. But as you know, there has been many challenges that have affected our activities. And of course, rabies is not the only priority in this country. we are using the same resources to target other challenges that come across in case you have got an outbreak of other disease, for example, CBBP or FMD. The same people, the same resources that you are having, the same that you have to target. We have also seen the challenge that came with the drought that hit our country in 2018, 2019. It really significantly affected our activities. The issue of COVID-19, I think we are all aware. The issue of distance, we were not able to gather communities to bring their dogs for vaccination. But beyond COVID, we were able to pick up. And since then, our activities and our achievement have been steadily and constantly improving. The trajectory have been going up. The number of dog vaccinated, and then the number of rabies cases. As we speak this year, from January until until September, I think we have only recorded, nationally, we have only recorded one death in human. And that is an achievement for the country. And another thing is that also surveillance and reporting system have also improved. As I have alluded to, that we have improved our diagnostic capacity as well as data collections. We started with a paper work. Now we have gone to using the app, and it really helped us. We are using a unified investigation protocol for rabies investigation, both Minister of Health, Minister of Environment, and the human, meaning that if there is a case reported on the ground, all of us, we have to go to the ground. We have to identify the affected people. We have to identify affected animals. We have to identify infected animals as well as infected human beings, if there is any. And then all what is required to be done in terms of response have to be given to both sides, with all the teams involved well informed by what is happening on the ground. Institutional support as well as regional leadership, I think I have already elaborated on that, but the most crucial one is that we really made sure that our collaboration with WOHA is well strengthened. And we, as I have alluded, our official control program has been endorsed. And we are also collaborating now with other organizations which are helping us in analyzing our data and also strengthen our laboratory capacities. And on top of that, our integrated approach, it's strengthening the readiness for other zoonotic diseases, meaning that the rabies control approach, it paved a way or a pathway to control other diseases. It makes way because we have already institutional established. We have already what do you call the structures that are already established, which we can actually build on. And through the tripartite One Health national strategy, it recognized that many pathogens affecting humans, they comes from animals, and they calls for a joint action to zoonosis. Recently, there is one issue which came out so strongly, which is the antimicrobial resistance, and is part of the initiative which came under the tripartite One Health national strategy. And I think this is now a global issue. And also the environmental health as well as surveillance. And the systems that are built for rabies, this is the mass dog vaccination campaign, the community engagement, the data management, and then the cross-sector coordination. Now, as I have alluded to earlier, it serves as a foundation for controlling other zoonotic diseases. For example, in our country, diseases like anthrax, diseases like hemorrhagic congo fever. Of recent, we have got an outbreak on that. And also other zoonosis diseases which can arise from wildlife. And also by institutionalizing One Health at a national and the regional level, Namibia is better prepared to detect, to respond, and also to prevent outbreaks beyond rabies. Because if you have already a framework.
Nawa ake biyan su nasu kafin ka shiga cikin su?
Ba biyan komai ba. Thank you. I was just saying that through One Health and at national and the regional level, we are better prepared to detect, respond, and also prevent outbreaks beyond rabies. And we have to leverage through the existing capacity that we have built up, through the existing infrastructure, because the same infrastructure, the same people, the same resources that we are having to implement activities for rabies, we can use it for other diseases, as well as on the cross-sector network. I think in short, that's what I can respond to your question. Over to you, and thank you very much.
Thank you very much, Dr. Rona. Few statements that caught my attention is, first of all, not leaving the community and to integrate livestock also when to integrate livestock. So sorry, to integrate livestock when to integrate dogs when vaccinating livestock. And I must say, recording One Health is a big achievement. This shows that you're doing so well in tackling rabies. Thank you very much, Dr. Ravona. On to the next part is Dr. Mary Obi. And Dr. Mary Obi is going to speak to us on grassroots. We'll now shift to the grassroots. I sincerely apologize for that. We'll now shift to the grassroots and private practice perspective, which is a crucial part of building community level resilience. Dr. Mary Obi, you've been deeply involved in the field of campaign, particularly rabies vaccination drive. My first question to you is, you actively lead rabies vaccination campaign on the field. What are the major challenges and successes you have observed? Thank you.
Okay, thank you very much. Yeah, one of the major challenges is someone came up and said that he heard that rabies affects all dogs, but not all dogs die due to rabies, that some are more resistant. And I now had to tell him no, that a rabid dog cannot even survive for 14 days after showing rabies signs. But those are the things they hear or they come up with. And some too will always tell you that there's no need vaccinating your dogs because some are more immune, like the local dogs, our mongrel here. They believe those ones, nothing can affect them, which I also had to tell them that it's false. So most people are not aware. So we kept telling them, kept preaching, vaccinate your animals, vaccinate your pets, and that rabies is real. And they also feel like, okay, that's one of the challenges, the awareness. But there are some older ones in the community that said something about this certifying dogs that are fit, that back in the days, that once you see a dog, I think there was a tag attached to vaccinated dogs. So once you see a dog on the street or you enter a house, you'll be like, okay, this dog is certified fit or has been vaccinated. So they advise that we bring that into our current rabies drive and all that. I told them that's for the government. I'm not a policy maker, but I'll relate that too to my superiors because they said that was one of the like assurance they had then when they see dogs that, oh, this one is certified. That it's not about like what we do presently in Nigeria. We have a dog pet green book where we put our stamp and we sign that this dog has been vaccinated. But most people don't have that handy. So they want an assurance where if they see a dog, just by seeing the dog, sighting the dog, they'll be like, oh, this dog has been vaccinated and they are safe around that animal. Thank you very much.
Thank you very much, Dr. Mary. I took a word from you, safety. So secondly, how can private veterinary clinics complement government efforts in zoonotic disease control? And yes, in zoonotic disease control, please, I would like you to answer that.
Okay, thank you. Yeah, for private government partnership, it's key because we the private vets we are the grassroots veterinarians. We interact with people, dog owners, pet owners. So we know, we vaccinate them, we treat, we diagnose. So we see first-hand information, we see first-hand cases. And then the government too can partner with us by empowering us, giving us incentive, like what our colleague said in Namibia, that 80% of vaccination was covered by government. We don't have it here. Previously, most of the free anti-rabies vaccines I give is from my personal savings. I do that personally. So if government can come in there, then there's something I notice here in Enugu. I'm sorry if I'm indicting any department or anything. Then in Jos, the dog bite cases are always dog bite cases are always reported to state vet clinics. There in Jos, in the state veterinary hospital, or since they have the research institute, NVRI, those are the 2 points where dog bite cases are always reported. They have desk officers there that they report these cases to. And from my internship there with them, I noticed that once dog bite cases, they report those things there, the state government or NVRI gives them a covering letter, an official covering letter, directing them, like those in NVRI VOM, National Veterinary Research Institute, they direct them to the Christian VOM Christian Hospital to take the post-exposure human vaccines. Then for those in Georgetown properly, they direct them to, there's a pharmacy, a known pharmacy, Lamed, then. I don't know if the present actions there now. So those were the things that were done then in Jos. But when I came to Enugu, the first dog bite case I handled, I told them I wasn't going to do anything, that they should go to the state vet hospital. They went to call me back. I started making calls, called few family friends that are human medics. They directed me to a pharmacy, just a regular pharmaceutical shop, where we could get the post-exposure rabies vaccine. So in Enugu, I don't know, let me not quote, but there's no desk officer where they report dog bite case. And there's no standard procedure, like what do you do? Who do you report to? Because I notice here that just random pharmaceutical outlets sell post-exposure rabies vaccines. I don't know if it's right, but seeing what is done in just Plateau State, I think it should be replicated here in Enugu and other states too. So that's where government should come in too. And then disease reporting. Most times we're encouraged to report diseases we encountered there in the field. But like some of my younger colleagues will tell you, the state government should give us incentive, because if I know that I'm getting incentive reporting diseases, I will be gingered, that my morale will be high. I will report all the cases. But since we are not getting anything, so I'll be like, what's my business? Why do I need to report this disease? But it's by default, as a veterinarian, it's your duty to report diseases, especially zoonotic and diseases that's of a human health concern. Thank you very much.
Thank you very much, Dr. Miri. That was really insightful. So finally, my final question is, what role does community trust and education play in building long-term resilience?
Okay, the community needs to first trust the veterinarian first of all. Once they trust you, they listen to you. You can have the best equipment, the best vaccines, the best everything. But if the community don't trust you, nobody will come out, nobody will listen to you. They'll say, all these government people, because once they see you talking, they just feel you are from the government. Maybe they've paid you something. So that was it. We had to build that trust with the community. After building the trust and letting them know that we understand what they pass through, we understand we are with them, we feel what their pains and everything, then we now start educating them. That education is very, very important because from our campaign, people were now aware and they'll be like, oh, I will tell my family, I will tell my friends, I will tell my neighbors so that they will know this. They need to vaccinate their pets. We need to do this. Once a dog bites you, you need to report and start taking your post-exposure vaccine pending when the confirmation of the condition of the dog. So that community trust and education, I think from what I've seen now, it's going to go a very long way in this our drive in eradicating rabies 2030. Thank you very much.
Thank you very much, Dr. Miri. Now I will call on to my co-moderator, Dr. Suleiman Nuhu, to take on to the joint panel discussion. Thank you, Dr. Nuhu.
Thank you very much, Asia, for the opportunity. Dr. Miri, thank you very much for your insightful contributions and especially the area of awareness that it's a problem in Nigeria, especially in our rural communities. I'll take on the joint panel discussion, and we are going to be looking at practical action steps for Africa. And when it comes to the issue of rabies, so also zoonosis, and also neglected tropical disease, I think Africa, especially with rabies, Africa is second to Asia when it comes to rabies, dog-mediated rabies burden. And it's a problem that we are still trying to curtail. And there is low awareness, there is low synergy between parastatals, between organizations, and between practitioners, also field and field practitioners too. So my question goes to the discussants, and I will be asking SARS and MAS doctors, what are the low cost and also high impact actions that Africa can take up to strengthen zoonotic resilience? The low cost, high impact actions that we can take as African countries can take up to in order to strengthen zoonotic resilience, not only for rabies, but also for other zoonotic diseases. So I think I'll start with Dr. Ibrahim, Dr. Idris Kelta, if he's in a position to speak. Dr. Idris. I think Dr. Idris is unavailable. Dr. Raunama. Okay. I think we have Dr. Idris. So, sir, what low-cost, high-impact actions do you think African countries can take in order to strengthen zoonotic resilience, sir? Thank you, sir. Okay, I think it would be best to pass on the question to Dr. Rona. Dr. Rona,
Can you hear me?
yes, we can hear you, ma. Thank you, ma.
Yeah. Thank you for this question. It's a bit of a challenge because it's not a one size fits all answer. But from what we have learned from our implementations is that your activities or your activity that you are going to implement, which are of a low cost, but can have a higher impact action towards rabies control, it should be focused on rabies dog vaccinations as well as surveillance, meaning that your action, your vaccinations activities or your vaccination campaigns should be informed by your surveillance data. Because if you do a blank implementation without knowing exactly what do you have on the table, you might end up wasting much of your resources. For example, number one, as a country, you have to first determine your dog populations. How you have to estimate your dog population. How many dogs do you have in the country? Where are they in the country? And then secondly, you have to look at your surveillance data. Where are the positive cases are, both in humans and also in animals? What are the drivers of those positive cases? Is it a spillover from wildlife, or is it a circulating virus within the dog populations? Secondly, how that impact the human being, because apart from you securing vaccine for dogs, at the beginning you should also focus on what is the right word, investing on post-exposure prophylaxis for humans, because the people that are affected, they need to be taken care of. They need to get their post-exposure prophylaxis. What is the bite rate in which area? And it will help you also to understand how many doses that are you going to procure for your post-exposure prophylaxis, and the distribution. It also should be informed by the dog bite data. And by doing that, your focus now should be now on identifying what you call a herd immunity in terms of the number of dogs that are vaccinated and they are protected. Because we are not only talking about vaccinating, but we have to also to make sure that the dogs are protected, they have built up on immunity, and they are able now to break the transmission, further transmission of the rabies among the dogs. Definitely, you cannot vaccinate your whole population for human being. That is a very higher cost. That one cannot be done, cannot be achieved. There are countries we have tried and it costed them so many millions and millions. I think that's what I can contribute towards the question. Data, and the data is very, very crucial.
Thank you very much, Dr. Rona, for your insightful contribution. The take home of what I got from what you said is you mentioned the issue of herd immunity, of which it can only be attained through vaccination, continuous vaccination. So also investing in data and surveillance. It's sad to know that in most of our countries in Africa, we don't even know the number of our dogs, and that is an area to look at. We need to be data oriented when it comes to our decision making. Thank you very much, Ma, for that insightful contribution. I think I'll go to the next question, which is how can governments, NGOs, and also field practitioners collaborate without duplicating efforts or competing for space. Well, I don't know, but the idea of One Health framework is still new, in especially our African setting, and there is still, in sort of synergy, you see competition, you see a lot of problems when it comes to the implementation of One Health framework and also the development of the resilience map. So, how can government and NGOs, and as well as field practitioners, collaborate without duplicating effort in order to conserve resources, and also without competing for space in order to build a more resilient One Health framework?
That is still directed to me?
Yes, you can go ahead.
Okay. Okay. I think the most crucial thing here, governments and NGO, they have to build what you call partnership. And this partnership can only comes when there is trust. Partnership have to be built on mutual partnership. On mutual trust, meaning that we have to be transparent with one another. The left should know what is the right is doing. We have to be transparent in our implementation. We have to be transparent in our in terms of sharing our common goals, as well as on sharing the data. Like, for example, as I have alluded to earlier, we are in Namibia, we are working in collaboration with other organizations, as well as other partners. And they do activities that interact with dogs, which are our center of interest, because by controlling rabies towards eliminating dog-mediated human rabies, we have to focus on the center, the dogs that are at the center. And for example, I give an example of Have a Heart. Their interest is on dog population management. Dog population management, it does not contribute directly towards eliminating dog-mediated human rabies, but it more on limiting the population within a certain community, meaning by spaying and neutering dogs. And then you have got a situation where you don't have unwanted litters roaming on the streets, and they have got no one to take care of. However, as government, we comes in to say, okay, if there is any other organization that is supporting us in terms of procuring vaccine, it doesn't do any damage for us integrating that component within them. And we have to speak to one another. And as people, they bring their dog for neutering and spay, it can also get a shot for vaccine. In that case, they have solved a problem within that community. And as government, we don't have to come there to duplicate. What they need from them is for them to share this data, because this data, it has to be integrated into the national data. And the same applies what we do with the cheetah conservation funds. They are more into wildlife. And if that community area, they are living proxy to the wildlife, you normally have got cases of a spillover from wildlife to the community, whether it's to humans or to their dogs or to their livestock. And we said, look, if you are able to procure vaccine, you can also vaccinate the dogs in that particular area. And then they share that data with the national services, and we integrate them into our data. And during now our review and planning meeting, we incorporate all those activities together, and then we see as a nation what have achieved. And we don't go and duplicate or implement the similar activities or same activities in the area where these NGOs have to. And I can just say that this can only be achieved once you have got your national plan, your national policies and legislation in place, which are clear, and it clearly stipulates what do you want other organizations to contribute, and how do you want them to contribute. And it has also to be explained to them, because they need to understand. And this has to be now built on mutual understanding and a mutual trust. If you are there to compete for one another, I don't think it will be practical. And I think as a country so far, we are doing very well. Thank you. Over to you.
Thank you. Thank you very much, Ma, for your insightful contribution. And I can say that the take home from what you just said, Ma, is the issue of partnership and most importantly with transparency when it comes to sharing data and information. Thank you very much, Ma. And I think my co-moderator will take on from here. Thank you.
Thank you very much, Dr. Nuhu. Dr. Mary, I have a question for you. Dr. Mary, kindly notify if you can hear me.
I can hear you.
Okay, ma. How has War Against Rabies Foundation been help to you in Enugu State?
Okay, thank you very much for that. I must applaud our founder, Professor Grace. She really came through for me because she personally funded the campaign here in Enugu. All the materials and everything we used there, she provided them. So I must give it to her. Thank you very much, Ma. So I pray that we get more funding so that we can carry out, because this year we could not do free anti-rabies vaccine because there was no funding for that. But hopefully we pray that we'll get more funding so that next year we can vaccinate dogs here in Enugu. But War Against Rabies Foundation, in fact, it just made me like a star in Enugu because I could carry, it was my dream to carry out such campaign and awareness, but Professor Grace came through for me. So I'm really grateful, ma. Thank you, ma.
That's really beautiful. Thank you very much, Dr. Mary. So now we will go into the questions. We will take a few questions from our audience. If you have a question, kindly drop it in the chat or raise your hand. Then I will take a few questions from the audience. Thank you. Also, please, if your question is going to direct to any of the discussants, kindly also notify when asking your questions. Thank you very much. Okay, so
All right. So we are still awaiting your questions. We can send in our questions through the chat box. Okay, I think I have seen a question. Tessin Sylvester asks a question and he asks, how many days is the post-exposure prophylaxis PEP supposed to be applied? How many days is the post-exposure prophylaxis supposed to be applied? So I don't know. Our mommy, the CEO. Mommy, can you take up this question, ma? The question
Are
on
you sure?
post-exposure prophylaxis.
Okay, are you sure that none of the moderators and the discussants can handle it before I come in?
Okay, ma. Okay,
So it's PEP
Dr.
we're
Mary,
talking about.
yes.
Before I answer your question, we've actually spilled.
Sorry, let me take that. I think there are 5 shots
Okay.
There are five, not the days, there are 5 shots pending when you confirm the status of the dog. But I interacted with a human medic in one of the hospitals here in Enugu, a human practitioner. He said the people in the infectious disease unit told him that it's only 3 shots he's supposed to take. I didn't want to argue with him, but I told him, I said, that's not proper. He said when he was exposed to a rabies victim in Abakaliki also, that the infectious disease unit told him that it's only 3 shots he's expected to take of post-exposure. But I told him that wasn't what we were taught, and that wasn't the right thing. So, Ma, I don't know, you can come in here.
So for our country, Nigeria, thank you very much, Dr. Mary. For our country, Nigeria, the ministry, the ministries involved advocate for 4 doses. The country still uses the intramuscular, which is quite expensive. However, the intradermal, which is the WHO much campaigned for strategy, will actually help a lot if the country is able to adapt it. And we're working towards that. Let me just add, because listening to Rauna, I'm envying Namibia. But Nigeria is also working. It might look slow, of course, because of the size and complexity of our nation. We are highly populated compared to Namibia, and so our complexities will be definitely more. But we're also working with Global Alliance for Rabies Control (GAG) to produce a rabies rapid response toolkit. And so I was really excited to hear her talk about how they've been using it and how it has enhanced their data as a country, and also, the impact of that to their control of rabies. So I will advocate that we also go through this WHO course that has a lot for us to learn. So I would ask Dr. Theophilus if you can just get the link for that WHO course, the 3 hours course, so that we can all go through it. So in summary, what I'm trying to say is, for Nigeria for now, we still use the 4 doses. It's 4, 5, but because of economics, we just do 4 intramuscular, and yeah, our medics have a lot to learn, but they are not totally wrong, because depending on the route you're using, it also determines the number of doses you take. For instance, the intradermal will just be 3 doses. So we need to read that WHO book course, and also do it so that it will enhance us and we the practitioners, and then it will help also when we're doing awareness campaigns and when people come to us for information, and also so that it will prepare for when we actually begin to use the rapid toolkit that we have validated, the Global Alliance Rapid Toolkit that we have produced for our country and validated just a few weeks ago with the funding of partners. Hopefully very soon it will be launched. Then maybe like Namibia, Nigeria too, the Ministry of Livestock, which has started doing very well. Will be able to fund some of these things, because when our country's ministry is able to fund majority of the rabies control strategies, I think it's faster, and there's more, the impact is more felt. You heard what Dr. Rawuna said about the Namibia, and Mary mentioned it. 80% is funded by the government. So nobody comes and plays around with your system because you have owned it, as a country. So we are very grateful that we now have the federal ministry that is, dedicated to animal diseases, and diseases that are transmissible. I mean that, you know, um, affect humans through animals as well. And their concern on rabies is very clear. They are working on it, and we hope that they will invest much more than they did this year into rabies control. Okay, so I think I should stop here because our time is fast spent, so that the moderators can continue. Thank you very much.
Thank you very much, Mommy, for the answers to the questions. I can see Dr. Barnabas Jeremy raising his hand. Doctor, you can go ahead, sir, with your question, sir.
Okay. Good afternoon, everyone on this call. It's a pleasure to listen to our speakers. Thank you, Dr. Rana, and then Dr. Kyota, and also Dr. Mary Obi. So mine is not a question; it's just a contribution. I just want to attest to what Dr. Mary said. I worked in Enugu, and then some of the challenges she faced were challenges I also faced. So I've been thinking around it, especially when it comes to our human counterparts. And then of recent, I just thought, okay, why not we, the veterinarians, from the veterinary perspective, through the Veterinary Council of Nigeria, is it possible for us to see how the council can help us get through the Nigerian University Commission, and then such that the syllabus can be broadened, the syllabus can be widened, more especially for the human medics on the area of rabies and then other zoonosis? Because of recent, I also interacted with one on Twitter. He listed out a number of professionals, and then veterinarians were out of it. So I went directly to his DM and I was like, I'm a social person and I saw your post. How do we get to talk and all of that? And then I was trying to educate him. So in a nutshell, majority of them don't know so much about rabies. So I feel the Veterinary Council through the NUC through the Veterinary Council can come up with some of these things and then see how we can bring them up into the curriculum, both the veterinary curriculum and also the medical curriculum. And then by such way, this form of awareness will get these counterparts to know about what rabies is, how we can, because it's not a competition, it involves everybody. And so that's just my own contribution.
Thank you very much, Dr. Jeremy, for your contribution. It's something that is highly needed in a time like this. We need to add up more of our zoonosis and also other issues of health to our curriculum. And I'm seeing another hand being raised. I think it's Stephanus Joshua. You can go ahead, sir. Stephanus Joshua.
Okay. Hello.
Hi.
Hello.
Yeah,
how are
good
you?
afternoon, sir. Fine, sir.
Thank you. I want to commend our presenters for excellent presentation. And then I also want to make a contribution as a medic. Yes. She did mention that, of course, she has been having some issues, especially with the medics actually dealing with human cases. Of course, the truth about it is that we know that for management of dog bite cases is 5 doses of anti-rabies vaccine that we use in human beings. Of course, we know that just as the CEO said, it also depends on the outcome of the report you get from the veterinary teaching hospital, from the vet. Usually, we know that we quarantine dogs for 10 to 14 days. And by then, in most cases, hello?
Yeah, we can hear you, sir.
Okay. I said in cases, by the time we get report from the vendor, of course, depending on, there are several other factors where bite is, you understand, and so many other factors. But the practice is 5 doses of human anti-rabies vaccine. We know that we up to one of the major factors there has to do with the cost of the vaccine. But of course, we know that we all know how fatal rabies is. I think issue of course, when a patient needs 5 doses, we should not deny a patient the 5 doses of anti-rabies vaccine that he needs to get. So, and just as he has mentioned, of course, the intradermal route administration is the main thing that WHO is proposing. And it will be good for both the human medics and also the veterinary medics to actually go through these courses so that we also use those information when we are doing our own enlightenment and also during other engagement that we have. I also support what the other person said in terms of the curriculum, but I think we can also start that right from the beginning when we start having joint conferences. You understand? When we have conferences that has to do with human medics, of course, vets should also look for a team to apply. And also vis-a-vis, when we have conferences organized by vet, human medics will also submit abstract, you understand, and then sub-team. By so doing, we have cross-fertilization of ideas, and then we can now take all those information to our other colleagues on the human side and also on the veterinary side. Thank you very much.
Thank you very much, Dr. Itufanus. That was an amazing contribution, sir. The issue of conferences and then the issue of collaboration is highly indicated, sir. Thank you very much, sir. And I think I saw Sherifat Balogun Raji raising up her hand. Can you go ahead, ma? Thank you, ma.
Good afternoon, everyone. My name is Sherifat. I'm a vet, and I work with the State Ministry of Agric, FCT. So I just wanted to highlight, first of all, I'd like to give kudos to all presenters, especially the representative from Namibia. I think you all are doing a great job, and your work is highly appreciated. So at the FCT, where I work, I'm the chairperson for One Health, Rabies, Rapid Response. And then there's so many challenges that we face when it comes to rabies elimination within the FCT, the capital city of Nigeria. First and foremost are that when there's a report of a suspected case of rabies, let's say dog bite, we use a One Health approach to immediately go to the field. So most of the reports usually come in through the human counterparts, and then we have a good collaboration with the state epidemic, the state EPID for the FCT. So he gives us a signal that there's a dog bite, irrelevant of if it's confirmed or whatever. We check if it's a provoked or non-provoked. If it's whether it is any of the above, the veterinarians still move over to the case, try to assess the dog, and then do apart from the assessment, we also evaluate, are we going to take this animal to our facility for the quarantine, or it will be a home quarantining. The home quarantine usually mean that the owner would have to check for the signs of rabies for 7 days and also take pictures and videos for 10 to 14 days. But the most challenge that we face is usually in the confirmation of rabies in the FCT. So we all know through our background knowledge that we sever the head, take some parts of the brain, the brainstem, the hippocampus, and the rest. But this challenge that I'm trying to talk about is that by the time the veterinarians get to the place where this dog bite case has happened, FCT is a place where we have the baggies, and the baggies they consume dogs. Usually, the dogs has been burnt, killed, or sold to those who consume dog. So it's usually a big setback in accessing the dog, picking up the sample, you understand, getting to confirm rabies like the usual way. So this has been a challenge to me personally. So in a case where the animal has been consumed or sold, what are the things that could likely be used to, so that we move from suspected probable to confirmation, where the animal is not even available? Are there any suggestions that anyone on this panel could give me to make my work better? Thank you very much.
Thank you very much, Dr. Sherifat. I think our mommy, the CEO, can take up the question, and then from there she can wrap the whole conversation up. Thank you very much, ma.
Thank you, Dr. Nuhu. But for the response, I think we can re-echo the question so that Dr. Rauna or Dr. Mary can respond to that, and then I will wrap up the meeting, because I'm sure they, as a speaker, as the discussants, have something to say on that. Thank you very much. So re-echo the question. Thank you, Dr. Sherifat. Can you repeat your question? Thank you.
Okay, so I say in most cases, when the One Health rapid response case gets to a scene of a dog bite case or a suspected rabies case, the fact that the people of the community, the baggy community of the FCT, consume dog, and they usually feel that a more aggressive dog is a tastier dog. They quickly pick up the dog, and then in most cases, we cannot even pick up the dog to confirm that it's a confirmed rabies case. So what are the things that could be done when we are having incident cases of the suspected rabies dog being picked up and eaten or burned?
Thank you very much. So please, our discussant, feel free to respond to that question.
Okay, I can come in, but
Yeah.
before I answer to the last question, maybe I wanted to make contribution to the post-exposure prophylaxis as to how many, if the question was correct, how many doses should a victim of a dog bite receive. I think countries who are subscribing to the WHO as an organizations, they are all using the WHO protocol. And the common one and the most old one that have been used is the intramuscular, which uses 4 doses. I don't want to speak on behalf of the medic, but as a veterinarian, that's what I know. I once was a victim of a dog bite, and I can also speak from the experience. Of recent, I think a lot of research has been made, and some vaccines has been produced, which shows that if it's given intradermal, it can equally give the same protection as the intramuscular. However, it's more costly, as Prof. Grace have alluded to, and it will now depend from individual country of which one will they adopt. I think it depends on how much resources do you have and what you can afford. That would drive now for you to change your protocol as a country towards that. Coming to the last question as to if you are now faced with a suspect rabies case in a community, whereby by when you arrive, the animal has already been consumed, and now you are faced with a challenge whether you should regard this as a highly suspect or it's a positive based on the clinical sign as given by the community, because we haven't seen the animal as a veterinarian. I can give the answer based on our own approach as a country and also what our protocol dictates. Our protocol dictates that you have to investigate the case. And during the investigation, you have to ask all the relevant questions. Number one is the questions on the animal itself, the questions on the number of people that are affected, and then also you also have to get an understanding from the community. These interactions or this attack, was it a provoked attack, or it was something which was giving, or an animal which was giving a typical rabies symptom, because especially in Namibia now, rabies symptoms, they are well known to the community. Through our education, the experience that they had in their community, they will be able to tell you that, yes, this is a very typical rabies case. And our investigation protocol is an integrated one, meaning that if it involves wild animals, the wildlife people, they have to be there. If it involved a dog or a livestock, and then the human people have to be there. And in case of the absence of an evidence, we have to treat this case as highly suspicious, and all the other people that are affected, whether they were bitten or they have handled these animals, they have to go to the hospital as soon as possible to get a post-exposure prophylaxis based on the investigation outcome. This also applies to a case whereby maybe suppose the animal has been killed, and then they have buried the animal, and then you were only able to retract the samples like few days later, and the samples, they are very, very, very disintegrated. Okay, you can still correct the sample and see if you can salvage something, but in case the answer comes not really convincing, we have to treat it also as positive, because the whole idea here is to protect the human being. It's not about saving the vaccine, but it's to protect the human beings. Thank you. Over to you.
Thank you very much, Dr. Rawuna, for that response. And I want to also appreciate Professor Istifanos Joshua for his contribution earlier. I have been working with him for a number of years, right from when he was in ABU, before he moved to lecture in Kaduna State University. And now he is on secondment to Taraba State University. Is it State University or Federal University? He is serving as their pioneering dean, I think, or provost of the medical school there. I stand to be corrected, sir. So he is so knowledgeable about on rabies, and that's why he is involved in so many of the rabies, workshops that we do. And he is also part of the War Against Rabies Foundation for long, for long, though officially is not yet completed, but I mean, he's been part of our work. So thank you very much, Professor Joshua. I'm so sorry that we're not able to take all the questions because today is Friday. And so our brothers and sisters might need to go to the mosque to pray. So that's why we're trying to rush it. However, to add a little to what Dr. Sharifat asked. So your experience in Abuja is not too different from what we have been experiencing in other parts of the country. Like recently in a pilot study in Zaria, we had to intercept two dogs that were sold to the dog market seller or to the dog sellers, butchers. Because these dogs had bitten human beings and they were on quarantine, but because the owners of the dogs discovered that they are rabid, they started manifesting signs, they rushed to go and sell. And we had to involve the force, the police people, courtesy of the assistance from the DVS of the state. We have a very active DVS who helped, to ensure that there was cooperation. So we had the force agents, police people helping us, and we were able to buy back. We actually had to buy back the dog that was sold almost at the point of being slaughtered for food. And so we also had, so we have similar experiences like that. So I'm just sharing this example so that you see also how you can intercept, such case in such cases. However, like Dr. Rauna has said, if you do not have any means of confirming, because the sample is not available, either due to such issues as being slaughtered for food, then the best thing is to treat as a suspect rabies case. I see Dr. Idris is coming up. I don't know if he has a last word to share before I finish wrapping up. Thank you very much, sir. I'm sure you have
All
something.
right, thank you so much. I see. What I want to add that really taking ownership of One Health at subnational level. By doing so, we are really making the One Health real practical and actionable and also impact to our communities. Thank you.
Thank you very much, sir. And so you see, so Nigeria also has a national strategic plan for rabies control, which is actually expiring this year. So ideally, we should be planning on, to review it. Nigeria, I have been saying, we've done a little. We have some little progress, though not as well as good as Namibia, because I'm sure Namibia has a stepwise approach to rabies elimination score of maybe 2 above. But Nigeria, we're just 1.5. So there's so much to learn from Namibia, and as you heard from her, Dr. Sharifat mentioned risk evaluation. I'm sure she meant they do risk assessment so that they can be able to know what to do to the patient, the victim of dog bites. And that's the beauty of the rapid response toolkit that we have worked on with the Global Alliance for Rabies Control GAG. By the time it comes out, we'll have a uniform way of assessing dog bite cases, of attending to any issue that has to do with rabies. It covers every aspect of that. And it also has a way of uniting us as professionals so that we work with that One Health mentality. And so building on that, you see, it will help us with zoonosis, which plague our nation. Wow, there is so much that we have learned today. I can't even go through it, but I'm sure we will be sharing today's link. We will share so that you can share with friends, so they can also learn from it. There was something that Rauna mentioned on sustained leadership. I actually wanted to ask a question on that, but we don't have the time. So maybe another time we'll get to ask her to come to talk some more to us so that we can learn as a nation. Somebody asked a question on why we do not do serological testing for to determine if the titer in the dogs that we vaccinate or the people that are vaccinated, if I get it right, is sufficient or not sufficient. I just want to say that, some of these tests are very complicated because they require a lot of they require some procedures that we might not be able to run in our country at this point. For instance, when you're going to do serological testing for an individual person or individual animal, what you do, except if it's for maybe a bulk testing, we can use the ELISA, which my students we have done lots of work on checking the titer level of be it maternal antibodies or vaccine-induced antibodies in animals. We have also done, I know my friends have done for humans also when probably prior to a workshop, like in Dr. Rauna and I we in 2015 in the Pridemics workshop by Pasteur Institute, our blood was taken and then they checked for the titer to rabies, and we were considered fit to enter the lab. Then they used the ELISA, all right? But when you have individual, like few samples, the standard that is being used is the REFIT, that's a rapid fluorescent focus inhibition test, and or the FAVEN, that's a fluorescent antibody viral neutralization test. And this requires steady power supply. Secondly, it requires cells, live cells. It requires living viruses that you're going to use as antigens. And so to maintain living cells and living viruses, it takes a lot. The nutrients that they need to be nourished to stay alive, the power supply, etc. MVRI, some years ago, with the help of Sabeta Claude, from the South Africa. I remember very clearly that was around 2013, in the early 20s, I think 2012 or 2013, something like that. He was in the country and he was trying to help them set up, tissue culture facility, also with the aim of having things like a FAVEN or REFIT being done in the labs. But, I think it worked for a while, but for now, it's not working. But they are working towards revitalizing such things. And so hopefully, we're praying that, such tests will be able to be done in our country so that we don't have to be spending so much money sending abroad to get results that we can actually generate at home, because a few of us have been trained, and we will be able to do it if the condition is suitable. At this point, I will say that I truly appreciate. I'm so grateful to each and every speaker, the moderators, and all of you participants who made this dialogue impactful. Thank you so much for being here. Today, in summary, we explored how the rabies is controlled, not just it's not just a health intervention, but it's a model for resilience. We've seen that. It's a gateway to building systems that can prevent and manage other zoonoses effectively. So the insights we've shared reminds us that collaboration is our strongest tool. Moving from the reactive campaigns that we do to proactive resilience requires integrated surveillance, community engagement. And I actually prefer to say community. So when we say engagement here, we're talking about the community being owning the vision to the extent that they drive it, and the cross-sectional sector partnerships, as we've heard from Dr. Mary, Dr. Idris, and Dr. Rawuna from Namibia. To our moderators, Dr. Nuhu Suleiman, and our dear student, Dr. Asiya Salahuddin, thank you so much for steering this conversation with clarity and energy. And to everyone here, let's take these lessons beyond this platform, please, beyond this platform, and turn them into, actionable, turn them into action. Chip Talk Africa is a monthly web dialogue, and it remains a space for innovation as well and partnership. Together, we can build a continent, the African continent, where zoonosis no longer threatens livelihoods and lives generally. We look forward to having more time with you. Dr. Rawuna, please, I hope you're not going to get tired with us, because we'll invite you next year to come and share some more from your end. Thank you so much, everyone, for attending. We're so grateful. When Dr. Mary was saying Grace, Professor Grace sent help, I'm like, no, this is not Grace. It's all of us, the War Against Rabies Foundation. Thank you so much for being wonderful guys to work with. Do have a great weekend. God bless us all. Thank you.
Thank you. Thank you very much for the invitation.
Thank you so much. Dr.
Thank you
Idris,
very much. Thank
safe
you, ma'am.
journey. Thank you so much, Dr. Mary. Thank you so much, Rohuna. Abdulaziz, thank you so much for staying to the end.
So much for having me. Thank you so much.
Thank you. Dr. Samuel, sorry we didn't have time to ask you to ask your question. We're so sorry. It's the time. Dr. Esther, thank you for attending. Samuel
Thank you, ma. Thank you, ma.
Thank you so much. Amina Yunusa, thank you so much for attending. Jeremy, always faithfully attending. Thank you. Dr. Godwin, thank you. I hope your presentation was awesome.
Yeah, it was awesome. Thank you. I'm happy to have joined you, and I'm happy to have seen you and Dr. Idris, my big brother and friend too. Happy to. Sorry, I missed your presentation. I hope I'll catch up on next one, sir.
Thank you so much.
We'll have the recording link
I will
shared.
be your defense.
Okay.
Thank you.
Let me stop the recording now.